Good afternoon, everybody. Thank you very much for coming. I wanted to bring everyone up to date with the national fight back against the new coronavirus and the decisions that we've just taken in COBRA for the whole of the UK. As we said last week, our objective is to delay and flatten the peak of the epidemic by bringing forward the right measures at the right time so that we minimize suffering and save life. And everything we do is based scrupulously on the best scientific advice. Last week, we asked everyone to stay at home if you had one of two key symptoms: a high temperature or a new and continuous cough. Today, we need to go further because according to SAGE, the Scientific Advisory Committee on Emergencies, it looks as though we're now approaching the fast growth part of the upward curve. And without drastic action, cases could double every 5 or 6 days. So, first, we need to ask you to ensure that if you or anyone in your household has one of those two symptoms, then you should stay at home for 14 days. That means that if possible, you should not go out even to buy food or essentials other than for exercise, and in that case, at a safe distance from others. If necessary, you should ask for help from others for your daily necessities. And if that is not possible, then you should do what you can to limit your social contact when you leave the house to get supplies. And even if you don't have symptoms, and if no one in your household has symptoms, there is more that we need you to do now. So, second, now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel. We need people to start working from home where they possibly can. And you should avoid pubs, clubs, theatres, and other such social venues. It goes without saying, repeat the message, we should all only use the NHS when we really need to, and please go online rather than ringing NHS 111. Now, this advice about avoiding all unnecessary social contact is particularly important for people over 70, for pregnant women, and for those with health conditions, with some health conditions. And if you ask, well, why are we doing this now? Why not earlier or later? Why bring in this very draconian measure? The answer is that we are asking people to do something that is difficult and disruptive of their lives. And the right moment, as we've always said, is to do it when it is most effective, when we think it can make the biggest difference to slowing the spread of the disease, reducing the number of victims, reducing the number of fatalities. And as we take these steps, we should be focusing on the most vulnerable. So third, in a few days' time, by this coming weekend, it will be necessary to go further and to ensure that those with the most serious health conditions are largely shielded from contact, from social contact, for around 12 weeks. And again, the reason for doing this in the next few days rather than earlier or later is that this is going to be very disruptive for people who have such conditions, difficult for them, but I believe it's now necessary. And we want to ensure that this period of shielding, this period of maximum protection, coincides with the peak of the disease. And it's now clear that the peak of the epidemic is coming faster in some parts of the country than in others. And it looks as though London is now a few weeks ahead. So, to relieve the pressure on the London health system and to slow the spread in London, it's important that Londoners now pay special attention to what we're saying about avoiding non-essential contact, and to take particularly seriously the advice about working from home and avoiding confined spaces such as pubs and restaurants. Now, lastly, it remains true, as we've said in the last few weeks, that risks of transmission of the disease at mass gatherings, such as sporting events, are relatively low. But obviously, logically, as we advise against unnecessary social contact of all kinds, it's right that we should extend that advice to mass gatherings as well. And so we've also got to ensure that we have the critical workers we need that might otherwise be deployed at those gatherings to deal with this emergency. So from tomorrow, we will no longer be supporting mass gatherings with emergency workers in the way that we normally do. So mass gatherings we're now moving emphatically away from. And I know that many people, including millions of fit and active people over 70, may feel, listening to what I've just said, that there is something excessive about these measures. But I have to say, I believe they are overwhelmingly worth it to slow the spread of the disease, to reduce the peak, to save life, minimize suffering, and to give our NHS the chance to cope. Over the last few days, I've been comparing notes and talking to leaders around the world, and I can tell you that the UK is now leading a growing global campaign amongst all our friends and allies, whether in the G7, the G20, the UN, the IMF, all those bodies in which we play a significant role. We're leading a campaign to fight back against this disease, to keep the economy growing, to make sure that humanity has access to the drugs and the treatments that we all need. And the UK is also at the front of the effort to back our business, to back our economy, to make sure that we get through it. I know that we are today asking a lot of everybody. This is far more now than just washing your hands, though clearly washing your hands remains important. But I can tell you that across this country, people and businesses, in my experience, are responding with amazing energy and creativity to the challenge that we face. And I want to thank everybody for the part that you are playing and that you're going to play. Our Chief Scientific Advisor will now update us on where we are. Over to you, Patrick.
Thank you. So we've looked all along at SAGE at measures that can save lives and protect people. The objectives, as I laid out last time, are to really suppress the curve in order to keep it below NHS capacity so that the NHS can cope, and to shield the vulnerable and those most likely to get severe disease so that we protect them across this period. Most people, it's worth reminding us, have a mild disease, but some do not. This is a very fast-moving situation. The latest numbers that we reviewed at SAGE suggest that we're entering a fast growth period or on the cusp of doing so, and London is ahead of other parts of the country. We at the outset laid out a plan and advised that we would implement it, the measures, at the right stage and in the right combination to ensure that we get the biggest impact. Unfortunately, that time is now for many of these measures. What we're doing is implementing them actually at a stage of the epidemic which is a little bit earlier than has been done in some other countries, given where we are in terms of the epidemic now. The measures have two objectives. One is to delay the transmission of this virus across the community, and the second is to keep people safe. The measures, as the Prime Minister has outlined, include whole household isolation. So if one person gets the symptoms of new persistent cough or fever, the whole household stays isolated for 14 days. The reason it's 14 days is the 7 days for the person who's got the infection, the incubation period that others may catch it, and the 7 days after that. We're also recommending increased social distancing. That's the phrase that you hear, which means trying to reduce contact between people, again, to try to delay this transmission. That means where businesses can do it and where individuals can do it, home working is recommended. Unnecessary travel should be reduced and stopped. Avoiding gatherings in crowded places is important, and those gatherings, big or small, are important so that you get the whole thing together. It's not just the size of a gathering, it's actually all gatherings which become important. And reducing social contacts. There are specific measures for the vulnerable groups, the people who are most likely to get serious illness with this infection, and Chris Whitty will say more about that. Those measures would need to go on for 12 weeks or so across this period, maybe a little longer. These measures, like case isolation that we talked about last week, staying at home if you've got the symptoms, these new measures have a big effect. This is not a series of small interventions. You would anticipate that this could have a dramatic effect to reduce the peak and to reduce death rate. They are not easy, but they are important, and they will have the effect if we all do it. This is a matter for us to take accountability, to make sure we help each other, protect ourselves, and protect the NHS. It is also possible, as laid out in the plan, that other measures may be necessary, including at some point, as we've said, it may be necessary to think about things like school closures, but those things, again, need to be done at the right time, in the right way, at the right stage of the outbreak. I'll hand over to Chris.
Thank you. I'm just going to add a few comments additionally from a medical point of view, but I'm not going to repeat points that have already been made. And the first thing is to make an obvious point that this is now a very global disease. And the way you deal with global pandemics is different in public terms, health terms, than the way you would deal with a localized outbreak where you're the first country or a very significant region that has got it. And the second point is the obvious point again, that in this country, this disease is now accelerating up the curve, but it is still at a low level, but it will accelerate up now really quite rapidly. Now, we obviously need to do things that are both effective, and all the measures that are here have been gone over by several large numbers of scientists in different ways, looking at mathematical models, behavioral sciences, many other forms of science to find the things which are the most effective, but they also have to be sustainable, because this is going to go on for some time. And I think we should not be under any illusions that if we just do this for a couple of weeks, that is sufficient. This is going to have to be a prolonged period. Now, for any individual person, let me start off with the most cheery point about this. For any individual person, the chances of dying from coronavirus are actually very low. Some people will not get the infection, and many of the measures we're doing at the moment will help with that. Some people will get it and will have no symptoms at all. They won't even realise they've had it. Of those who do have symptoms, the majority will have either a mild disease or a moderate disease, meaning they can easily manage it at home without having to go to the NHS directly or indirectly in any other way. But obviously, a small minority, but a significant one, get significant disease requiring hospital care. A small proportion of those will go on to need intensive care, and sadly, some people will go on to die. And as we've discussed before, the overall mortality rate looks as if it's a bit less than 1% on current data, but that's without knowing how many people get the disease asymptomatically. But we know some people get it. Now, we also know that older people are at greater risk, and that is widely known. But it is important, I think, to stress that being old does not necessarily mean you'll get it worse. And actually, there was a rather nice article by my minister, Nadine Dorris, who actually explained when she had coronavirus, her mother, who caught it from her, had it more mildly. So it's not a necessary fact that older people will necessarily have it worse. So you might say, why with a disease where we have such small numbers at the moment and which the great majority of people are going to recover from, and most of them will have a mild or non-noticeable disease, would we want to do anything at all? And the reason is this acceleration. And our overall aim and our single aim is to reduce death rates and the numbers of people who might die as a result of this. But I think it's important to recognise, and the reason I'm explaining this is so people understand the logic of what we're doing, that there are broadly three groups of deaths and other impacts on health we need to consider. There are the direct deaths, which are caused by the coronavirus disease itself. With good medical care, tragically, a few people, the great majority of them in less good health, but not necessarily all, will pass away. There are, however, and this is really important, a significant number of other deaths which, if the NHS became overwhelmed in any of the four nations, if the intensive care units got to the point when they were overwhelmed, then people would die from indirect deaths because they did not have the ability to get medical care. And a lot of what we are trying to do is trying to reduce the chance that those indirect deaths might occur. And then the third possibility, and it is an important one for us to consider, is that some of the measures we are doing will undoubtedly or could have negative impacts on people's health themselves. So there are negative effects of what we do to try and combat the coronavirus. One of the reasons we are very keen not to go in advance of need was because of those negative facts, and I'll come on to one of them later on. Now, just to explain where the different things fall into this, the very profound changes in terms of social distancing that the Prime Minister laid out, which are going to be very difficult for people to maintain over a long period of time and will have very significant social effects, do have the capacity significantly to pull down the peak of this infection wave and therefore make it easier for the NHS and particularly the ventilation support to be able to cope with the wave that is heading its way. So that is really critical. People who do this, who restrict their social gathering, are doing things to protect the NHS, to allow the NHS to treat both people with coronavirus and people who have other things as well. It has an overall effect on the NHS. This is the second group of things which the Prime Minister has laid out, are those things that we want the quite large group of people who either are over 70, possibly quite healthy or very healthy, over 70 but over 70, or who are younger than 70 but have a significant health condition, and this is mainly in adults. We want them to take even greater care, because this is in addition to making sure that they don't end up helping fuel the epidemic themselves. It means they do not have to go to hospital, which is good for the NHS, but most importantly, it reduces the risk that they will catch the virus, particularly at a time when the NHS is under strain. This is absolutely critical. And the group of people who we want to take this advice particularly seriously are older people above 70, people who in adult life would normally be advised to have the flu vaccination. So these are people with chronic diseases, such as chronic heart disease or chronic kidney disease. And also as a precautionary measure, because we are early in our understanding of this virus, and we want to be sure, women who are pregnant. And those three groups are the groups we want to take particular care to minimise their social contact, which of course will have very significant risks for them. And later on, we will be giving very shortly, a much more specific list of an even smaller group of people who have very profound health problems. They all know they've got very profound health problems. For example, people who might have advanced myeloma or leukemia, things that significantly affect their immune system. The final bit that is being talked about today is, in addition to what we've previously talked about, is the 14 days stay at home. If one person in the household has symptoms, the whole household stays at home. Now, there has to be some common sense around this. If there's a very vulnerable person in the household, for example, people will need to take that into account. We'll need to think, people need to think through the practicalities of their own position. But the reason for this is because they are helping to stop it be transmitted onto the rest of the community. And these people, the trouble is, if you actually are in a household with someone who's got coronavirus, there is a reasonably high chance you will be infected and will go on to get this. So this is, in a sense, something people are doing to help protect the rest of society. We do want to stress that the great majority of these people will have mild or moderate disease. They don't need to contact the NHS. They can use the NHS online service. There's very extensive information there. We really would encourage them not, if they have mild or moderate disease, to phone 111, because the service we need to protect for those who are in greatest need. But, really important to stress, if anybody's health starts to deteriorate significantly, then they should phone 111 or contact the health services in the way they usually would. So this is, if people deteriorate, we want to make it clear they should then do so. Finally, I just want to make a point on behalf of my other CMOs for all 4 nations. We are enormously proud of what our colleagues in the NHS and public health have done so far to delay this and to do so in a safe way. And an enormous amount of work has gone on to do that. The next few weeks and months are going to be extraordinarily difficult for the NHS in all 4 nations. We know that our colleagues will rise to this challenge, but we know it is going to be very hard indeed, but we have enormous faith in them. Thank you very much.